Hello, everybody. Welcome to our research webinar for the month of March. Just give it a few moments as people begin to come in. If you would like to put in the chat where you are tuning in from, we're always very interested to know where our audience is. And if you have any questions during the presentation, we ask that you put them in the Q&A section, which you'll see at the bottom beside the chat. And the questions we will address at the end of the presentation. So to begin with, I'm just going to introduce the Canadian Coalition for Homeopathy and say a little bit about our mission and about the webinar series of which tonight's presentation is a part. And here's the poster for tonight's event. So the Canadian Coalition for Homeopathy launched in April of 2022, and the mission of the coalition is to bring together patient associations, homeopathic practitioners, researchers, and industry stakeholders who wish to promote homeopathy in Canada and preserve the freedom of choice in medicine. And part of the objective of the research webinar series is to help spread the word about homeopathy to the general public, as well as to allied health professionals who perhaps don't know much about homeopathy and would like to learn more. So you can visit our website, and there you will find links to our YouTube page where all of the previous research webinars are posted. You can join our newsletter if you'd like to stay up to date about future offerings as well. And so a few more points about the coalition. We aim to educate the public on the many benefits of homeopathy, to debunk false information about homeopathy, to dive into the research supporting the efficacy of homeopathic medicine, and to defend and promote the access to homeopathic medicine in Canada. And again, part of what we're doing to achieve all of these aims is to have this year, every month, a research webinar presentation. And we've already had a few in the series, but there are several more that are up and coming. Next month, we have a recording from Rachel Roberts with a panel discussion. In May, we have a presentation from Ananda Moore, the director of the film Magic Pills, who some of you may have seen. In June, we have a presentation by Richard Grossinger, a wonderful author and a great supporter of homeopathy. In September, we have another presentation that's put on by one of the members of HRI. And last month, we had Alex Tournier, also from HRI, and his presentation is available for viewing. In October, we have Christophe Merville. And lastly, in December, we have Gerald Pollack. So if you'd like to find out more about these webinars, again, please visit our website and join the newsletter, and you will be kept up to date about all of these presentations. And I just want to say a quick word on behalf of the coalition for special thanks to Boiron, who, due to their support, were able to make these webinars possible. And we just want to say a word about their new app, Remedies, which is for home prescribers. And it's quite a useful app, and you can download it for free. And it's a mobile app that helps you find the right homeopathic medicine to naturally relieve everyday ailments. And it was put together by a very trusted team of health professionals and homeopaths. So here's a little bit more information, which you can also see on the Remedies website. And you can see right here, remedis.app, and that will take you to the website where you can learn more. Okay, and with that, I will hand it over to you, Stephen, to introduce tonight's presentation.
Great, thank you. Thank you very much, Victor. Yes, I'm Dr. Steve Malthouse. I'm a Canadian physician on the West Coast, Denman Island, British Columbia, and I'm a family doctor, but I was tricked into learning homeopathy by my wife, who enticed me to go down to the United States to listen to some people speaking about homeopathy, presenting cases. And after I saw that, there was, I think, Ronald Davy, who was the Queen's homeopath, the Queen of England's homeopath. There was historians, there was a veterinarian homeopath, and there were a number of practicing MD homeopaths. And once I got hooked on homeopathy, I integrated into regular medicine. And then along the way, I met Dr. Whitmont, who's our guest for tonight. So let me just introduce Dr. Ronald Whitmont, who's going to be presenting tonight on homeopathy and pain. And Dr. Whitmont is a former president of the American Institute of Homeopathy and the Homeopathic Medical Society of the state of New York. He was a clinical assistant professor of family and community medicine at New York Medical College, where he directed a student elective in complementary and integrative medicine. He was board certified by the American Board of Integrative Medicine and was a founding diplomate of the American Board of Integrative Holistic Medicine. Ron is currently president of the National Homeopathic Product Certification Board, a trustee of the board of the American Institute of Homeopathy, and medical advisor to Americans for Homeopathy Choice. He is second-generation homeopathic physician who maintains a private practice in classical homeopathy in Rhinebeck, New York, in the United States. And Ron was just telling me that he's becoming a blacksmith as well. And we were just discussing how how do you have time with all those things to be a homeopath and to learn how to do blacksmithing. So Ron, it's a pleasure to welcome you back. We haven't seen each other for quite a long time, and it's nice to have you here. So you're going to
Thank
talk
you.
today about homeopathy and pain, and I think you have a slide presentation. Would you like to just take it away?
Yeah, let's come back in about a half an hour and I'll start then. Let's go. Sure.
Okay.
All right. Thanks very much, Stephen, and thank you, Victor, and thank you for having me. I was just going through the chat there. It's really amazing how many people you have from so many different places and parts of the world. So very impressive. Thanks for having me. So let's see. Put this up. You can see my screen?
Yep, you can see it just fine.
Okay. So we're going to talk about pain, inflammation, and recovery this evening. And my apologies from the start because this was originally a 2-hour presentation that was rapidly cut down in size over the last 2 days. So we'll do what we can and see where this brings us. But the subtitle of this presentation is No Pain, No Gain. And the points are essentially the way we treat pain, acute pain and inflammation is wrong. And this is the conventional treatment, and that the human microbiome is essential for pain, inflammation, and recovery. And that in essence, homeopathy is what ties it all together. Or in fact, what the microbiome tells us is how important homeopathy is. And that's really the bottom line message for our talk tonight. So this all comes actually from Canada, believe it or not, some researchers at McGill University published a paper in Family Practice News that said, in a surprising discovery that flies in the face of conventional medicine, McGill University researchers report that treating pain with anti-inflammatory medication like ibuprofen, aspirin, promotes pain in the long term. What we've been doing for decades not only appears to be wrong, but it appears to be 180 degrees wrong. You should not be blocking inflammation. You should be letting inflammation happen. That's what stops chronic pain. That inflammation is actually nature's pain reliever. And it turns out that when you block white blood cells or neutrophils using anti-inflammatory medications, that pain typically lasts about 2 to 10 times longer than normal. That despite providing short-term pain relief, anti-inflammatory medicines or NSAIDs prolong it and make it chronic. That from the journal Science and Translational Medicine, they wrote that despite analgesic efficacy at early time points, the conventional management of acute inflammation may be counterproductive for long-term outcomes. And that not only that, the timing is very important. When you're managing pain, when the resolution of inflammation is initiated, usually within the first few hours after inflammation or the inflammatory response begins, that granulocytes or white blood cells promote the switch from of arachidonic acid derived prostaglandins to something called leukotrienes and lipoxins, which are what initiate the termination of the inflammatory sequence. And anti-inflammatory medications block that transformation. They prevent the termination of inflammation. That acute inflammation is actually what helps resolve pain. That transient neutrophil-driven or white blood cell-driven upregulation of inflammatory processes was protective against the transition into chronic pain. That when you downregulate inflammation in the early stages using steroids, anti-inflammatory medicines, opioids, even antibiotics, that this leads to the prolongation of pain and eventually chronic pain. If there's no pain, you do not resolve inflammation or healing. And this is really critical, that inflammation occurs for a reason, and it looks like it's dangerous to interfere with it, particularly in its earliest stages. And that when you block inflammation, it slows recovery. So again, from science and translational medicine, you should not be blocking inflammation. You should be letting inflammation happen. That's what stops chronic pain. Inflammation is nature's long-term pain reliever. So this is out of a conventional, these are all quotes from conventional medical journals, okay? Conventional medical management suppresses acute inflammation. It blocks pathways of resolution. It delays recovery, prolongs pain. And what we're going to talk about a little bit later is it also damages mitochondria and it damages the microbiome. It increases morbidity and mortality. I want to start out with a couple of examples of this so you'll know what I'm talking about. First aid, generally physicians, medical personnel have been taught all to use this thing called the RICE protocol, which means rest, ice, compression, and elevation. These are supposedly the backbone of acute care and injury management, sports medicine, all these things. Well, you think they've ever been tested? Not until recently. A paper in the New England Journal of Medicine determined that when you start rehabilitation from an injury sooner than the recommended 9 days, so you started at 2 days, rather than waiting 9 days, the interval from injury to pain-free recovery and return to sports by 3 weeks without any significant re-injury. So in other words, if you shorten the time period by the time that you start mobilization again, you actually speed recovery from re-injury. And this was a graph published in the New England Journal of Medicine showing in the green line up here, I don't know if you can see my cursor, but the green line here is if you start rehabilitation and movement again sooner, you end up actually returning to sports as early as 30 days. Whereas if you started after 9 days, you're doubling the time to return to sports. And for some people, you can see up on the graph, they never even get back to sports because you have delayed recovery so much. So this is really critical. This whole idea of resting after an injury has been debunked. And again, I want to point out one small detail here, that rest is antipathic to that injury. That what is actually a homeopathic or a small dose of the same thing that caused the injury is motion and activity. So again, we have the earliest inklings that this is supporting a homeopathic approach. You want to reintroduce motion and movement as soon as possible after an injury. So immobilization causes rapid deterioration of muscle and tendon structure and function while having a detrimental effect on connective tissue cells. That's from the Journal of Physiology. Well, what about using ice? Because that's pretty much a standard. When you injure your ankle, you do some muscle strain, everyone tells you to put on ice, which is again antipathic to that injury. Well, it turns out when you do animal studies, they suggest that using cold delays or impairs tissue healing and regeneration, that icing the skin leads to reduction in blood flow, resulting in tissue death and permanent nerve damage. And that's from the British Journal of Sports Medicine. So again, using something to cool down an inflammatory situation, inflammation is the body's response to injury, you work against it antipathically, you're actually causing more damage. For some reason in athletics, it is believed that cold after exercise is the best modality to prevent swelling and damage to muscle. At least for this age group that was tested here, in college students, this is not true. There is a definite advantage to using heat after exercise if applied or used immediately. Cold and heat both prevent muscle damage, but on balance, heat actually has small advantages over cold in increasing healing after a heavy workout. And again, heat is homeopathic to the injury. Heat relaxes blood vessels, it increases blood flow, it increases oxygen and nutrient delivery, it augments the inflammatory response. It works with, not against inflammation. It helps muscles recover faster after injury. So the best time to use heat on sore muscles seems to be immediately after exercise, and ideally for several hours. Muscles that were warmed immediately for 2 hours with moist heat or 8 hours with dry heat experience less damage and retained more strength than those that were heated later on. In chronic illness situations, those who have musculoskeletal disorders, including arthritis, fibromyalgia, hot saunas lower pain by releasing endorphins, regulating the nervous system, and reducing systemic inflammation. Now that's a chronic. Dealing with chronic inflammation is a little bit different than dealing with acute inflammation. But it's the dosage that seems to make the poison, as Paracelsus has purportedly said, that a moderate amount of heat or mild hyperthermia, when applied for a short time, has an immune stimulating or modulating effect and promotes various physiological functions of immunocompetent cells. Whereas an intensive heat, where you raise the body temperature over 41 degrees, has an immunosuppressive effect and can even lead to involution of lymphatic organs, which is not what we're trying to achieve. That according to the American College of Physicians, using a heat wrap reduces pain more than placebo and potentially even more than medications like Advil or Tylenol. That's from the Annals of Internal Medicine. So what about burns? So this was a study done in the Journal of Plastic and Reconstructive Anesthesia and Surgery. They wrote, in order to limit damage after burn injury, burn progression has to be prevented. Besides delaying burn progression, the application of warm water provided an additional benefit by improving the microcirculatory perfusion, which translated into increased survival. Now, who said this? Who started this whole idea? At least in my knowledge, Hahnemann wrote, the experienced cook holds his hand, which he has scalded, at a certain distance from the fire and does not heed the increase of pain that takes place at first. Again, where he's not trying to get rid of pain, he's actually increasing pain because he's increasing inflammation right then and there. And he knows from experience that he can thereby, in a very short time, often in minutes, convert the burn part into healthy skin. I don't know if any of you have ever tried this, but I have. And I was raised on this approach to burns. And I'll tell you, believe it or not, it's exceedingly effective. And you can immediately reduce a second-degree burn to nothing in a couple minutes. You don't put your hand in the fire, you give it the homeopathic small dosage of the same heat, and it increases the pain. You know it right away, and then it fades. So along with that ICE protocol, we still have compression and elevation. And this is from the Journal of Athletic Training, who found that there is insufficient evidence to recommend for or against compression and elevation for acute closed extremity joint injuries. And there's no benefit in the major outcomes of pain, reduction, swelling of these injuries in joint function or range of motion could be demonstrated. So again, these are classic recommendations that don't have backing in science. So how do we get this so wrong? Were we misinformed? Or was Hahnemann simply right? And he wrote, the palliative amelioration that at first ensues from the conventional treatment is far from being crowned by a rapid and perfect cure. On the contrary, the weak and ailing state of the parts thus treated shows the error that is committed. So let's talk, I want to go through pretty quickly, how do we manage pain conventionally using these kinds of drugs, and why shouldn't we? So start with anti-inflammatory medications. They are among the most prevalent pharmaceuticals used worldwide. Over 30 billion doses of over-the-counter doses are taken in the US alone every year, and they're prescribed in 95% of all doctors' visits. That used alone and according to standard guidelines, they're responsible for more than 20,000 deaths and over 100,000 hospitalizations every year just in the United States. It's hard to find data on the other countries, but I assume it's probably pretty close. And a study in the United Kingdom demonstrated that out of 500,000 people, those that were taking anti-inflammatory medicines were significantly more likely to have pain 2 to 10 years after the injury. A short list of side effects from anti-inflammatory drugs goes on and on, as you can see here, covering everything from kidney injury, low potassium, blood in the urine, decreased creatinine clearance by the kidneys, damage to the kidneys, type 1 respiratory failure, exacerbations of asthma, gastric erosions, bleeding, ulceration, damage to liver cells, high blood pressure, and other cardiovascular diseases. These are not benign medications. These are medications that are prescribed like they're candy. They shouldn't be. They are a common cause of kidney failure in children and adolescents, even when they're used according to the recommended dosage guidelines. Well, what about inflammation in NSAIDs? I mean, who really prescribes them for inflammation, by the way? I think they're used mostly for pain relief. But when it comes to inflammation, it's interesting because the chronic use of NSAIDs for inflammation actually increases the risk of blood clots and cardiovascular complications. That these are paradoxical pro-inflammatory, pro-clotting effects that are attributable to a compensatory host response, meaning a secondary drug effect of the anti-inflammatory. The anti-inflammatory suppresses inflammation, the body pushes back in what Hahnemann described as a secondary effect, and now you have the very thing that you're trying to prevent increasing in frequency. That by downregulating inflammatory pathways in a pulsatile fashion, taking one pill every 6 hours, that's a pulsatile fashion, the chronic use promotes compensatory upregulation of these same pathways and shifts the host baseline equilibrium towards a pro-inflammatory state. And stopping the therapy with aspirin, statins, and other anti-inflammatory medicines triggers rebound pro-inflammatory effects. When it comes to arthritis, a lot of people use anti-inflammatory medicines for arthritis. Well, the chronic use of these drugs accelerates the progression of arthritis. It decreases joint space width. It downregulates the production of cartilage. It inhibits the synthesis of proteoglycans, which are the building blocks of the cartilage, collagen, and the cellular matrix. It damages the cartilage. It weakens bones, prolongs healing time for broken and injured bones and soft tissue. ultimately, we're talking about worsening arthritis pain and speeding the destruction of joints, which is really handy if you're also a surgeon and you want to get in there and replace a joint. Anti-inflammatory medicines, their use can and does alter certain fundamental processes involved in the normal healing of injured tissues. It impairs normal skeletal function, leading to decreased bone mineral density, osteoporosis, osteopenia. It has negative effects on healing of skeletal tissues. Fracture healing and tendon to bone healing appear to be particularly susceptible to inhibition by NSAIDs. So by inhibiting what we call the COX enzymes and the subsequent prostaglandin production, anti-inflammatory drugs achieve their desired anti-inflammatory pain effects, but they also inhibit the increased production of prostaglandins that are necessary for bone healing to occur. So there's a direct opposition between removing the pain, alleviating the pain, and trying to heal. These things go hand in hand. And this is why we say no pain, no gain. So what about mitochondria? I mentioned them earlier, and mitochondria are pretty important. They are as you should know, they are the powerhouse of the cell. This is where our cellular energy comes from. And NSAIDs, or anti-inflammatory drugs, directly target mitochondria. They open what's called the mitochondrial permeability transition pore, which releases cytochromes or pigments into the body of the cell, the cytosol. They induce death of the cell by impairing mitochondrial calcium metabolism and inducing depolarization and oxidative stress. So when you damage enough of the mitochondria, the cells will die. They cause mitochondria to fragment, and they cause them to be removed by a process called mitophagy, which is the cell chewing up the mitochondria. They disrupt mitochondrial function. They uncouple something called oxidative phosphorylation, which is the way we produce energy from sugar. They directly interfere with that. So what happens if you interfere with mitochondria with these drugs, or any drugs for that matter? Well, it's associated with a wide range of chronic conditions, including things like Alzheimer's, Parkinson's, Huntington's disease, amyotrophic lateral sclerosis, autism spectrum disorder, cardiovascular disease, metabolic syndromes, type 2 diabetes and obesity, cancers, muscular dystrophy, autoimmune conditions, including type 1 diabetes, multiple sclerosis, lupus, and rheumatoid arthritis. This is from a journal called Endocrine Reviews. So, anti-inflammatories might be good for acute pain, but they're not so good for recovery, for healing, or the rest of the body. Really important that people are aware of the trade-off that they're making when they take an anti-inflammatory medicine after an injury. So the bottom line in this whole discussion really may be that pain is the wrong benchmark that we're using to measure successful treatment outcome. And so if you might even see studies on homeopathy that show it doesn't reduce pain right away. Maybe it does, maybe it doesn't, but that's the wrong benchmark. We shouldn't be looking, is it a good pain reliever? Because pain is part of the inflammatory response, and it's part of the healing response. I want to touch briefly on antibiotics because they're very important. There's a lot of antibiotics, antibacterial, viral, parasitic medications that also have immunomodulatory and anti-inflammatory properties. And I first discovered this treating Lyme disease, finding that people who were taking medications like doxycycline would report feeling better. And then we found out they're getting anti-inflammatory effects. They're coming off the doxycycline and their conditions are getting worse very frequently after all these medicines are stopped. It's because of the anti-inflammatory effects. So you have to be careful. The anti-inflammatory effects are separate and different from the antibiotic effects, even though they're the same drugs. What do these drugs do? They decrease tumor necrosis factor, interleukins. They suppress complement-derived chemotaxis. That means the transition and movement of neutrophils, which are white blood cells. They decrease white blood cell mobility. They inhibit lymphocyte transformation, which is what exactly gets our adaptive immune system to recognize and to have a memory towards future infections. They inhibit the function of monocytes and lymphocytes, and they inhibit inflammatory cytokines, which is critical when we're talking about inflammation. What do they do to mitochondria? And this is also very important because mitochondria and bacteria are evolutionarily related. And I don't have time to go into that today, but there's good evidence to suggest that these both arose from the same cells billions of years ago, okay? But because they're related, antibiotics that target protein synthesis in bacteria also adversely affect mitochondria and the transfer DNA encoded proteins that they produce. Bactericidal antibiotics are toxic to both, and they're considered to be a major contributing factor to the toxicity of mitochondria, okay? And anyone who's ever had the antibiotic ciprofloxacin, not anybody, but a lot of people can vouch for the fact that they were not the same afterwards. That the antibiotic-induced oxidative damage to mitochondrial DNA proteins and membrane lipids is associated with all these things that we've known about for years from these medicines. Damage to the ear, damage to the kidneys, damage to tendons, and things like aortic dissection. That's from JAMA, the Journal of the American Medical Association. And that every single fluoroquinolone that's been tested damages mitochondria in human liver cells in what researchers say is a strong effect at therapeutic concentration. And in fact, it takes 2 days to create damage to the liver cells, the mitochondria in liver cells. Some antibiotics, particularly the fluoroquinolones, cause muscle pain, injury, and weakness, and this side effect can be permanent. Steroids. A lot of people still use steroids, and long-term steroid use has been linked to impaired wound healing, compromised immune responses, and a hindrance of bone healing, alongside potential adrenal insufficiency during traumatic events. That they impair wound healing by repair by inhibiting the gene expression and the anti-inflammatory actions and suppression of multiple cellular wound responses. They delay fibroblast proliferation, and fibroblasts are the cells that literally pull a wound together and zip it up. They delay collagen synthesis, the formation of the scar tissue, and vascular proliferation and epithelialization, which are all important in healing a wound. Their immunosuppressive effects increase the risk of wound infection and they delay healing. And during the inflammatory phase of healing, they impair white blood cell migration, including macrophages, into the wounds, which help reduce the risk of infections. So chronic corticosteroid administration induces mitochondrial dysfunction and oxidative damage in skeletal muscles, which may be the pathogenesis, at least in part, of what we call corticosteroid-induced myopathy, corticosteroid-induced injury to muscles. I want to touch briefly on opioids. They have a long history of use and they have a long history of problems, including respiratory depression, heart disease, vomiting, constipation, tolerance, and the last one there, hyperalgesia, which is increased pain sensation. That opioid-induced hyperalgesia is a state of increased sensitivity to pain. It's a paradoxical secondary response, similar to that secondary response we spoke of earlier. It's the body's response to taking the opioid. The body produces more opioid receptors, and it increases the sensitivity of the opioid receptors that are already there. What does this mean? That means you have to take more opioids to get the same level of pain control. What does this mean? That means you increase the risk of getting more and more side effects, of depressing your respiratory system, of dying of respiratory arrest, which is how most overdoses end. The opioids also delay wound healing, and those who have never received opioids heal faster than those who have ever received them. Doesn't matter when you've had them. Most opioids negatively affect bone remodeling and bone healing. They're associated with increased fracture risk. There's a risk of non-union of fractures, and it's significantly increased in opioid users, and also bone mass density or osteopenia is increased in patients who've undergone long-term opioid treatment. What about mitochondria? It turns out that they also reduce mitochondrial numbers and the markers of mitochondrial damage, particularly in the region of the brain called the hippocampus, which has effects that I'm not going to go into here. So we know from this review of conventional literature, conventional pharmacological data, that mitochondrial damage can be caused by all these drugs, by antibiotics, antivirals, antifungals, anti-inflammatories, steroids, opioids, anti-neoplastic agents. They're all toxic to mitochondria, and they're also toxic to the microbiome, which leads us to our next section, which is the human microbiome, which I want to touch on briefly. The human microbiome from the International Journal of Molecular Science says, the human microbiome, or the microbiota, interacts with the human metabolism by educating the immune system, protecting against its pathogenic microbes, metabolizing non-digestible carbohydrates, producing essential vitamins and antimicrobial substances, stimulating angiogenesis, which is the formation of new blood vessels, and importantly, reinforcing the gut barrier through increased mucin or mucus production. What they're touching on here is that the microbiome is intimately involved in just about every process within the human body. And this is becoming more and more evident as more and more research is being done. That the microbiome is critical also to the speeding of recovery from injuries and resolving inflammation. It's integral to the experience and perception of pain. That dysbiosis, which is the loss of species diversity and the loss of symbiosis within the microbiome, it's associated with increased pain perception and chronic inflammation. And this is critical because most chronic illnesses today, and I can't think of any that aren't, are related to chronic inflammation, which means they're related to the microbiome. So, what about the microbiome in conventional medicine? Well, we are learning more and more that the microbiome diversity is critical to every aspect of human health, development, and homeostasis, and that all conventional medicines reduce microbiome diversity. Essentially, conventional allopathic medicine is not compatible with the microbiome. It's not compatible with ecology, and the body runs on ecology. What about microbiome science and homeopathy? Well, here's the kicker. Microbiome science reveals the exact, maybe that's the wrong word, it reveals the same principles that have been described by Hahnemann and have been revealed through homeopathy over the last 2 centuries. And this should be intriguing. The human microbiome is essentially an exceedingly complex group of different, stable, and unique ecological niches that exist in every single organ and tissue throughout the body. These are ecosystems, and they're everywhere. The ones we study the most are in the GI tract, the mouth, the esophagus, the stomach, the liver, the gallbladder, the intestine, the colon, but they're also throughout the respiratory tract, all the way up to the sinuses. They're down all the way to the alveoli. The alveoli of the lungs have their own microbiome. The blood has a microbiome, the skin has a microbiome, the breasts have a microbiome, the entire urogenital tract from the bladder, the urethra, the bladder, all the way up to the uterus, the placenta, the fetus, the developing fetus in utero has its own microbiome. In the placenta, in the amniotic fluid, the umbilical cord, the meconium. It's in the human prostate, the testes, the sperm, and it's in the human ovary. It's in the nervous system. It's in the brain, the central nervous system, the cerebrospinal fluid, throughout the eyes and the ears. We used to believe that most of these places were sterile. They are not. And the formation of the microbiome does not begin at birth the way we used to believe it did. Birth is a critical time in microbiome development because it means exposure to the birth canal and the organisms that are in the vagina and on the perineum. But it turns out that the microbiome begins at conception, not at birth. So let's talk about why the microbiome is important to pain and inflammation. It's intimately involved with brain development, behavior and cognition, perception, chronicity, and duration of pain. From Frontiers of Cellular Developmental Biology. From Frontiers of Psychology, the human gut microbiota, also known as the second brain, has an important role in the central nervous system by regulating it through chemical, immunological, hormonal, and neurological processes. That pain is regulated peripherally and centrally by substances whose production is affected by the microbiome. That the GI microbiome synthesizes multiple neurotransmitters, including GABA, noradrenaline, serotonin, dopamine, glutamate, endorphins, short-chain fatty acids, and tryptophan metabolites such as 5-HT, the others, tryptamine, indolic compounds. All these are involved in gut-brain communication and in the regulation of pain. That the GI microbiome produces neuroactive metabolites, neurotransmitters, precursors to neurotransmitters that affect concentrations of related neurotransmitters and precursors in the brain itself. That neurotransmitter synthesis pathway in the GI tract directly and indirectly affects neuronal activity and cognitive functions. So this is a new vision that it's not just the brain that's perceiving pain. The perception of the brain is affected by the microbiome. The microbiome is responsible for maintaining adequate concentrations of dopamine in the brain via the vagus nerve and the immune system. And there's been very interesting research coming out very recently about Parkinson's disease and the GI microbiome and how the two are linked. That dysbiosis in the GI tract is one of the causes of Parkinson's disease. That the GI microbiome is highly involved in dopamine metabolism, synthesis, and breakdown. That even some strains of E. coli, a bacteria in the gut, releases beneficial analgesic lipopeptides that cross the epithelial barrier, inhibit calcium influx mediated by sensory GABA neuron receptors, and thereby inhibit visceral pain hypersensitivity. The GI microbiome plays an important role in modulating visceral, inflammatory, and neuropathic pain pathways. It's a critical factor in many types of chronic pain, including headaches and opioid tolerance. That it plays a major role regulating microglia, astrocytes, endothelial cells, monocytes, macrophages, pericytes, and T cells in the brain. That these cells in turn regulate neuroinflammation and pain sensitivity by affecting the release of cytokines and chemokines that alter synaptic neurotransmission. So I want to just, as an aside, say, just remember this. We're coming back to this in a few minutes, but remember that you have this kind of holistic totality where the brain and the gut are interacting at such an intimate level that they're acting as one unit. We're not talking about two different distinct organs anymore. We're talking about so much interaction that they're really extensions of each other. That there's a disruption in the balance of the microbiome, or what we call dysbiosis, has been implicated not only in gastrointestinal disease, but also in neurological disorders, including chronic pain. And as I mentioned, also in Parkinson's very recently. The dysregulation or dysbiosis of the gut-brain axis leads to a huge variety of diseases, including visceral hypersensitivity, stress-induced hyperalgesia, or the increased sensation of pain, allodynia, inflammatory pain, and functional disorders. So I want to break down each of those things we talked about earlier, starting with the NSAIDs and the microbiome. Well, anti-inflammatory medicines, NSAIDs, have two effects. They have a direct effect where they disrupt bacteria in the gut microbiota, and they also have indirects through the neighboring organs to the gut, where they alter those organs, which alters the gut microenvironment, changing things like mucosa integrity and permeability, and microbial metabolism. But both of these effects can precipitate dysbiosis or dysfunction of the microbiome. Antibiotics, this is a no-brainer, that they indiscriminately kill both harmful and beneficial bacteria, and that they increase the risk of chronic inflammation. We've talked about that they increase the risk of cancer, they increase the risk of superbugs, which now kill over 150,000 Americans every year. When you use antibiotics, you're dropping a bomb on the microbial community. Everywhere in the body that those drugs go, you're affecting the microbiome there. That one of the most compelling findings, and this is from Yale University, which has a little bit of respect here in the States, one of the most compelling findings of the microbiome are the damaging effects of antibiotics on the human gut microbiome. Antibiotics used to treat an infection elsewhere in the body can also generate collateral damage on distal gut communities. A single course of antibiotics rapidly changes and decreases the number of bacteria species in stool communities, often followed by incomplete recovery after several months. Now, the argument has been, well, we can still keep using antibiotics, and we'll just throw some probiotics on top when we're done. But current evidence does not support that. This is from Nature Reviews in Gastroenterological Hepatology. Current evidence does not support the notion that probiotics can fully restore the microbiota to its pre-antibiotic state. That limited evidence actually suggests that some probiotics reduce the effect of antibiotics on gut bacteria, while other probiotics actually delay recovery after antibiotic damage. So not all probiotics are the same, and some actually can work against recovery after antibiotic use. And it's not just antibiotics, folks. It's not just antibiotics that are damaging the gut microbiome. More than 1,000 non-antibiotics have been screened against 40 representative gut bacterial strains published in the journal Nature, and they found that every single class of human drugs was found to inhibit the growth of at least one strain of organisms. That bacteria in the human GI tract reflect the medications that have ever been ingested, and geobiodiversity is significantly lower in those who have used antibiotics, anti-inflammatories, antidepressants compared to control groups. That opiates disrupt multiple areas of gut homeostasis. They also cause dysbiosis, and even short-term morphine exposure is associated with an increased abundance of pathogenic bacteria in the microbiome. They're associated with significantly reduced diversity and species richness of the gut microbiome, and chronic use is associated with GI burial damage, bacterial translocation, and the release of pro-inflammatory cytokines. So all of these drugs suppress acute inflammation, reduce pain, they damage mitochondria, they cause microbial dysbiosis, they promote chronic inflammation. They're being used here to treat acute inflammation. How interesting that they're creating a chronic state of inflammation. They're increasing the risk of chronic illness, and they're definitely increasing the risk of chronic pain. So what do we do about all this? Well, of course, there's always homeopathy. The human microbiome has been described as an invisible biological organ. But Hahnemann studied the clinical behavior of an invisible biological organ more than 2 centuries ago, describing it in the following terms. In the healthy human state, the spirit-like or invisible life force that enlivens the material organism as dynamis governs without restriction and keeps all parts of the organism in admirable harmonious, vital operation as regards to both feelings and functions, so that our indwelling rational spirit can freely avail itself of this living, healthy instrument for the higher purposes of our existence. The material organism thought of without life force is capable of no sensibility, no activity, no self-preservation. It derives all sensibility and produces its life functions solely by means of the immaterial, invisible life principle, the life force that enlivens the material organism in health and disease. If you look at microbiome science, you see that everything he's describing has been described by microbiome science. And the question here is it possible that the human microbiome is the same invisible organ that Hahnemann described and called the vital force? Well, if that was true, then they would have to agree on certain rules or principles, right? And I've included below a couple of these: holism, psychosomatics, direction of cure, law of similars, individuality and susceptibility, minimum dose and hormesis, and homeostasis. And I think we have time. I want to run through these really quickly. So when you start with holism, as I mentioned earlier, I wanted you to come back to this idea of holism between the brain and the gut. Well, it turns out there are multi-directional axes throughout the body: the gut brain, the gut lung, the gut kidney, the gut endocrine, the gut heart, the gut skin axes. They all exist. And there are axes that we haven't even studied yet, like the brain lung, the brain gut, the brain kidney. These are axes that haven't even been looked at yet, but they confirm and they suggest that there is a unified, integrative biological system that is integrally interdependent across every single organ and tissue. How is that possible? Well, we do have a microbiome in every single organ and tissue also. So we have actually the blueprint of how it could be done. Psychosomatics is just a branch of the same thing. It's a bidirectional communication and modulation pathway that exists between the GI tract and the brain and inside the brain. We know that the GI microbiome alters brain development and that the brain alters the GI microbiome diversity and functioning and its development as well. It goes both ways on that street. We know the microbiome displays intelligence, that there is a quorum sensing mechanism inside the microbiome that demonstrates collective behavior and collective intelligence between the organisms linked throughout the body. And they are a coordinated network. The same way when you see starlings, those birds that fly through the air and they all turn at the same time, guess what? Your microbiome demonstrates the same behavior through mechanical, chemical, and electrical systems that allow the microbiome to store information and adjust behavior based on past experiences. This study blows me away. It was published in the Proceedings of the National Academy of Sciences in the United States back in 2023, demonstrating that when mothers experienced hardship or PTSD at any time in their life, including during pregnancy, that there were changes in their own microbiome, but those same changes were passed on to their children. They also demonstrated that to children of those mothers demonstrated the alterations in their microbiomes from the trauma of their mothers, and they demonstrated similar impaired socio-emotional functioning compatible with the trauma experienced the generation before. So that whole transgenerational trauma thing, epigenetics, we see it mirrored in the microbiome as well. Direction of cure. We know that conventional medical management of most acute diseases leads to dysbiosis, and management of those dysbioses leads to chronic inflammation, and it gets deeper and deeper. And then when you have a sustainable recovery from a chronic illness and you resolve the dysbiosis, you notice a return of acute inflammation and return of what we call old symptoms. that fever being a hallmark of efficient acute inflammatory response, which may be disrupted in chronic inflammatory conditions, it usually is disrupted in chronic inflammatory conditions, that the return of acute inflammatory states with high fever predicts improvement in chronic diseases during treatment. Looking at similars. So similars is very curious because there are an abundance of different microorganisms working together in ecological symbiosis within the microbiome. And what they do is they protect against the incursion of other invasive organisms. So we know that the greater the diversity, the greater the spectrum of different organisms that exist within a given ecological community in the microbiome, the more stable that community is. And what that really means is that you have organisms protecting against organisms. And if you are missing organisms, if you have gaps in that structure, you are more susceptible to infection from other organisms. And an example of this is when you expose people through their lungs to mycobacteria, which is the same class of organisms that tuberculosis comes from. These mycobacteria actually act protectively against the development of things like asthma and bronchial inflammation. That when you expose them specifically to Mycobacterium bovis and Mycobacterium vaccae, they improve airway hyperresponsiveness, they lower eosinophil count in bronchial asthma. That even things in the gastrointestinal tract, hookworm, for instance, is a parasite that's associated with a significantly strong reduction in the risk of developing asthma. And it's in direct proportion to the intensity of the infection of the hookworm. So the more hookworm organisms or ova there are in the GI tract, the lower the risk of asthma and the lower the intensity of asthma if someone gets it anyway. Crohn's disease is an inflammatory bowel disease. It's a reaction that can affect any part of the GI tract, but it's only common in parts of the world where worm colonization is rare. And it's uncommon in areas like first world countries where most people, it's uncommon in the area, Crohn's disease, is uncommon in places where people carry worms. That again, there's this trying to get at this similarity of these organisms are actually creating a bit of inflammation to prevent global inflammation. You can give these worms to people who have Crohn's disease and it downregulates their global host immune response, and it's protective against Crohn's disease. And they did an open label study in the journal Gut back in 2005, demonstrating when you give the therapy to people with Crohn's disease, there was a near 80% improvement, actually complete remission rate of nearly 73% in active Crohn's disease without any single side effects. And you see the same type of thing in ulcerative colitis. Susceptibility. We know that every individual microbiome is uniquely different. No two are the same. It's so reliable that if you get a sample of someone's sputum or stool from a crime site, you can identify with near 100% certainty who that person was just by examining their microbiome compared to the forensic sample. One size does not fit all. And this is don't want you to get into this, but this is just an example looking at the different microbiomes of different people, even in different seasons, and how they change. There's an incredible amount of complexity. Each color is a different organism, and they vary not hugely, but significantly between individuals. Hormesis, when we're talking about minimum dose, is very interesting because it's a well-documented, nonlinear physiological and cellular phenomenon of adaptation characterized by a biphasic dose-response curve. You've probably all seen a graph like this about hormesis. Looking at areas down here in the lower part of the graph where a small dose is given and it has a beneficial effect, but a large dose can be toxic. According to Iris Bell, that convergent expert opinion suggests that hormesis is a nonlinear, adaptive, not a pharmaceutical process that a living organism utilizes as a complex adaptive system. This is, again, a secondary reaction to a drug is hormesis. And homeopathy excels in having the body create a secondary drug reaction, not a pharmaceutical primary type reaction, but a secondary drug reaction. Pharmacological agents have been used therapeutically. Very toxic agents have been used. Published this report in the International Journal of Molecular Science demonstrating that small doses of toxic substances that stress cells can actually allow them to adapt to things like infections without ever targeting the infection directly. Meaning, the problem with antibiotics is we're running out of antibiotics because all these organisms are getting resistant to antibiotics. But what if you don't treat the infection itself, but you stress the cell with something similarly damaging? You actually increase the resistance, and they found that these cells are actually much more resistant to infection. And graphically representing this on the left, you can see a small dose of an agent that causes stress, a small amount of stress and damage, allows a cell to adapt, create homeostasis, and it deals with pathogens. It blocks these other things. Whereas if you give a large amount, a pharmaceutical dose, you can damage the cells as we have described above, with mitochondrial damage, damage to the immune system, all these things. It can't adapt, the cell dies. And finally, homeostasis. That the microbiome is essentially one of the body's most important systems of maintaining homeostasis. And without a healthy microbiome, mental, physical, emotional health are unlikely and perhaps impossible. And there have been studies on this that are really fascinating to go into when they have raised germ-free animals out of, in isolation without exposure to bacteria in their environment. And it's remarkable what those organisms, what those animals cannot do. So, I'm going to skip through this really quick because I see we're out of time. I want to go over this again, no pain, no gain. I want to remind people of the EPI-3 study that demonstrated significantly decreased use of anti-inflammatory medicines when homeopathy was used. I want to remind people there was an 8-year observational study by Claudia Witt demonstrating, definitely mental and physical quality of life scores improving. The more severe the disease was, the better the result. Homeopathy with otitis media demonstrate that homeopathic medicines actually can work faster than conventional drugs. Homeopathy for bone fractures, we found that homeopathy actually speeds recovery of bone and reduces the need for pain relievers. Homeopathy for pain has been found to be effective in these conditions, including endometriosis, joint pain, stiffness, hemorrhoids, dental procedures, trigeminal neuralgia, nerve pain, musculoskeletal pain, bone fractures, labor pain, back pain. If anyone tells you there's no science, don't believe them. Rheumatic conditions, and for palliative cancer care. A study done on rheumatoid arthritis in the British Journal of Clinical Pharmacology looked at arthritis pain and found significant improvement with homeopathy and demonstrating grip strength improving, and found that those who did the best had these things called good prescribing symptoms, meaning they actually could tell you the details about what was happening. They weren't blocking the symptoms and saying it just hurts. Low back pain, also the same thing. They compared homeopathy to physical therapy, and they said they concluded nothing can be said against attempting homeopathy for the treatment of low back pain, even though it showed it was quite beneficial and it was superior to physical therapy. Post-operative recovery, arnica, they found that the effect is comparable to that of anti-inflammatory substances. I hope not, because we got problems if arnica is really and truly comparable to anti-inflammatory substances. I think they meant just when it comes to perception of pain, not to the reduction of inflammation. Osteoarthritis, the same type of thing. What's interesting here with osteoarthritis is that, oh, well, they found beneficial effects. So to conclude, essentially, the conventional treatment of pain is wrong. We started this with that statement from McGill University researchers, and we find that conventional treatment opposes the immune-mediated innate inflammatory healing response. It delays healing and recovery. It promotes chronic inflammation and chronic pain. It damages mitochondria. It damages the microbiome. It promotes dysbiosis and chronic inflammation. Ultimately increases pain, severity, morbidity, mortality of every known illness. Conventional treatment is at odds with nature, the environment, ecology, the body, the immune system, mitochondria, the microbiome, healing, and sustainable long-term health. It is also linked to the largest iatrogenic, meaning physician-caused, epidemic of chronic inflammatory illness in the history of civilization. Hahnemann said a long time ago, this non-healing art, which for many centuries has been firmly established in full possession of the power to dispose of life and death of patients according to its own goodwill and pleasure, and in that period has shortened the lives of 10 times as many human beings as the most destructive wars, and rendered many millions of patients more diseased and wretched than they were originally. This allopathy. The human microbiome is an invisible biological organ. It's critical to pain management, inflammation, and recovery. It demonstrates the same ecological principles and behavior that Hahnemann outlined. It confirms the principles. The human microbiome confirms the principles and practices outlined by Hahnemann and used in homeopathy for more than 200 years, that these are accurate, consistent, and compatible with cutting-edge science and ecologically sustainable medicine, which is why we're talking about it, okay? And finally, homeopathy ties it all together. It's backed by cutting-edge medicine and microbiome science, and it has the advantage of offering an established, time-tested methodology, materia medica, pharmacopoeia, for treating acute illnesses, injuries, and preventing chronic inflammatory illnesses and resolving pain. It brings us full circle back to the paradigm previously dismissed out of political and economic rivalry. So that's where I am, and I'm going to stop my sharing and see what the questions are.
Wow, that is a lot of information to take in, particularly for someone who is trained in conventional medicine. As you're speaking, Ron, I was just going over cases that I had seen over the years that kind of fit in with the detrimental effects of what we thought were good medicines. I think ciprofloxacin, which was is a very good example of that. I don't know if you have seen cases of inflammation of the Achilles tendons.
Oh yeah, and
I saw
rupture
that,
of the kidneys.
yeah, that was very common. I was surprised. I think I saw maybe seven different, sometimes two in the same person, right?
Yeah,
And
yeah,
it was pretty shocking. And I think what you're talking about is, and particularly all your references, which I noticed are very up to date too, that it kind of explains the pathways which would lead to these things that we call side effects, which are really effects
yes,
and suppressive effects too. I mean, as interfering with the human ability to recover and kind of diverting the disturbance to another location.
yeah, yeah.
Remarkable. I just wanted to comment on a couple of things, if I could, Ron, and maybe we can get to questions. Is that okay, Victor? Because I've found your talk fascinating. I was trying to write some questions down here, but I kept going. I didn't want to miss what you were saying, because I found a lot of light bulbs went on in my head as I was thinking about the connections and so
Great.
on. I,
Yeah, it's too short a
I,
time. It's too short a time to give this talk.
yeah, perfect time, because the world is kind of waking up to the sort of the adverse, heavy-handed and adverse effects of conventional approach to
Yeah,
inflammation, right?
yeah,
Or infection. So your talk is very timely, and people have been wondering where they're going to be able to access this later, because there's a lot of really good slides there, and
I think I can, share the presentation. You can share it with people if you want.
That's
I
great.
only ask if you do cite it, just give me credit for the slide. But
We will.
they're publicly available studies, so you can access them yourself, and they're right there. They're public, it's in the public domain.
That's great. Yeah. And but there's no point having the slides without having you talking along with them. So I think this is going to be put up on social media in some way. Is that right, Victor?
It will be on the YouTube channel of the coalition, yes. And I'll put it in the chat again so people can find it easily.
Great. A couple other things I want to mention. I don't know if you remember there was an anti-inflammatory drug, and a few people mentioned this in the chat, called Orudis. It was a very popular anti-inflammatory. It's not on the market anymore. It was taken off the market because people said, oh, it does relieve the pain in my knee joint, but then it was destroying the cartilage of the bones. So
Yeah.
this is a very good example of how by sort of attacking more of these, again, I wouldn't say necessarily superficial, but a component of inflammation, which is the healing response, and subduing it with a powerful anti-inflammatory, you actually cause a deeper destruction of tissues. And when they
Yeah.
found that, they took it off the market. Yeah. So,
Well, they knew about it when it was publicly.
well, yeah,
They took
most
it off.
likely they did, but they just didn't tell us. A bit like Vioxx, you know.
Exactly. Same type of deal, except with the heart.
The other one is I was kind of embarrassed because I remember once when I was in Hawaii seeing a young woman who had got sunburn on her feet, her feet, and so she had them in a bucket of warm water, and I discouraged her. I said, "Oh, well, that's not good. No." I said, "It's better." But that's the days. That was before I knew anything about homeopathy,
Oh,
and
okay. You're
yeah,
forgiven then.
and it does feel better to put it in cold initially. It's true, and that's
You're right. If you have a sunburn, and I've done this myself, you get into a hot tub at the end of the day, and it's even a mild sunburn is really painful, but you find the sunburn is gone the next day.
yeah,
It's
yeah,
gone. And that
and
was the pain. That was the inflammation working to resolve.
yes. But also one of your things was don't do too much. So don't put yourself into a super
Right.
hot environment. You
No.
just need a little bit of what
Yes.
caused the problem.
Right. It's just the hair of
Homeopathic.
the dog.
Yeah. The other thing I noticed that when someone tells me that I've got shit for brains, that's not actually an insult. That is a scientific statement. And I just
That's
thought
great. I didn't know
now
that.
I don't have to get upset when people say that.
That's
I think
true.
maybe
You're right.
it's true. It's true. And what else is some of the things, I guess there's so much you didn't talk all about vaccinations interfering with homeostasis and what that means. That's another whole topic, I
They
think.
do. They do interfere with the GI microbiome. That's been demonstrated.
Yeah. And another thing that you just touched on but didn't talk about was hippocampus, which there's been recent works by Michael Nels, who's a German physician, with regard to autobiographical memory and how certain substances, and you mentioned opioids, how they affect people's ability to remember. And autobiographical will be to do with things like Alzheimer's and different types of dementia. And I think that's a really important thing that people need to pay attention to. Particularly, we're seeing Alzheimer's occurring in people so young these days that
Yes. Yes.
it
And
could be to do with the,
and Alzheimer's is being connected again to the microbiome.
yeah,
But
yeah.
again,
So
the problem sorry to interrupt you, Steve, but the problem conventionally is they still refuse to change their paradigm. And when they learn that the microbiome is related to Alzheimer's, they say, oh, what antibiotic can we use now to kill those bad boy bugs down there that's causing Alzheimer's? No, you don't get it. You have to treat this thing as an ecology. You can't go in there with a flamethrower and expect that you're going to cure an ecological imbalance by killing more organisms. You've got
mhm,
to get the ecology into a balanced state again. And that's
yeah,
where homeopathy has been shown to excel. From the bowel nosodes to different approaches, using different medicines. But this talk should not be misconstrued as you should avoid homeopathy and try to use the microbiome. No, homeopathy uses the microbiome. We just haven't shown exactly what that mechanism is yet, but it does, and you know it does because it's producing the same results in mirror image to what the microbiome is showing us by conventional medicine destroying all those things.
Can you get the microbiome diversity to return through the use of homeopathy?
You can get microbiome symbiosis to return through the use of homeopathy, and that's one of the earliest researchers was John Paterson of the UK, who was a contemporary of Edward Bach, who developed the Bach flower remedies. And he studied people with different pathological conditions and looked at their microbiomes and found that successful homeopathic treatment always changed the microbiome and brought it back into balance.
Oh, wow.
We
Well, that
don't
would
know
make
about
sense.
it's the same species richness. We do know that it's bringing it back into symbiosis.
Well, that would make sense because if the human organism in a holistic way returns to health through the use of homeopathy, you wouldn't think that something would be left out, particularly
Right.
something as big as the microbiome.
That's
So
right.
it would make sense that it would also correct itself under the influence of homeopathy. What a great talk. I think maybe we'll turn over the questions to some of the people who have been listening. It looks like there's quite a few questions in the from the
Do you want to choose them,
chat.
Stephen, or how do you want to do
Yeah,
this?
well, Victor, I think you've been following them more closely than I
Okay,
have. Do you want to
Victor?
present some of them and ask Dr. Whitmont what he thinks?
Sure. One of them that I saw a few people put in was wondering about the effects of ivermectin, which of course has gained a lot of popularity. But I guess the question was specifically whether ivermectin, I guess with regards to any of its potential uses, can potentially interfere in similar ways to
Um,
some of the other drugs that you've discussed tonight.
the answer is yes. As far as we can tell, that ivermectin is an antibiotic. It's an anti-parasitic medicine that was used, in various animals. I think horses was one of the ones that was used in a derogatory fashion to accuse it being, not right for humans. But I have not studied ivermectin. I have not seen any studies of it demonstrating what it does. But I would assume that ivermectin is reducing the diversity of the microbiome in some way, because we know that it's not just bacteria, it's also viruses, it's fungi, it's archaea, and it's these things called parasites that are part of a healthy microbiome. And the examples of Crohn's disease and ulcerative colitis and asthma were demonstrating how parasites are extremely important in modulating the immune system and keeping it in a balanced state so that you don't create autoinflammation. And any antiparasitic, which ivermectin is one of them, has the potential to do that. The other class of drugs, which are really herbs, are things like turmeric. Turmeric is known for its anti-inflammatory effects. And I'm going to tell you, in the context of this revelation about pain control, we don't want to be reducing inflammation. And I would recommend that people do not use turmeric for acute injuries, not if they want to heal promptly, that they reserve that for chronic inflammatory conditions where um, the relative possibility of healing is less. But don't use any anti-inflammatory, whether it's an herb or a drug in an acute situation. Not
Hmm.
unless your life is depending upon it.
I guess the thing is there a time, Ron, like where you would use an antibiotic, where you would use an anti-inflammatory, where you would use a steroid, for example?
Yeah. Oh, yeah. These medicines are all great medicines, and there's a time and a place for them, just not in acute injuries, right? Not unless you have a raging infection that needs to be treated. But there's evidence that, like, open wounds, they have bacteria in them, right? They're normally colonized. You scrape your skin, you cut yourself on a rusty fence or something like that. There are bacteria in those wounds, but when you start putting antibiotics on them, like even topical antibiotics, they have shown that it delays healing of the wound. That the bacteria inside that wound are actually part of the inflammatory process that get the fibroblasts in there, that bring the white blood cells to the wound to do the repair and the eating up of, the bacteria process. So there's not even evidence on superficial infections that you should use topical antibiotics. You shouldn't. Antibiotics should be used for life-threatening and potentially life-threatening situations. Opioids should be reserved for intractable pain, never for acute pain. It should be used for intractable pain that cannot be resolved in any other way, or the risks of the other medications are unacceptable. Then you should use those things. And the same with anti-inflammatories. They should never be first line use for an injury. You should use arnica. You should use, something that has a proven track record without producing harm. This is where homeopathy excels.
I think the problem is that people don't have access to homeopathy, and I think that is changing as people start to see that conventional medicine is not as accessible in the last little while and is not as trustworthy as they thought. But it's a bit like my approach to conventional medicine is it's good for stabilizing in difficult situations. In other words, if you have a child with really severe asthma and you don't have a homeopathic medicine or something you can treat them with, then you may need to use an inhaled steroid. But you have to
Absolutely.
always keep in
Not
mind
the
the long
steroid,
term.
but the
Well, for example, I use steroids as one example, but there are other ones which are antispasmodics, which would be your
correct,
first choice, right?
correct.
But um, but I think so people do need a kind of a balanced view, but always keep the long game in mind. In other
Correct.
words, as you're giving it something which you thought was great to relieve pain, you may see that you're going to have longer duration of pain and less sufficient healing of, whatever the condition is, whether it's arthritis or a wound.
So why do we have a culture that is anti-pain, that won't let they won't let anyone have pain? Parents want to give their child Tylenol for their teething pain. We don't allow pain because it's evil in our language. What is that about? Pain is just a physiological mechanism that is activating the healing and the inflammatory response. It keeps us from injuring ourselves further. There are so many useful things it does. Why are we so intent on blocking it?
Well, because people think that pain means move away, remove the source of the pain or get away from it. And so it becomes like a secondary component of the
It's more
negative
than that. It's
thing.
more than that because people are afraid of pain. They live in
Oh,
fear of
yes. Oh, yeah.
number of people I've said, why are you afraid of death? They say, I'm not afraid of death. I'm
Yeah.
afraid of suffering and being in pain at the end. We have not taught people how to live with pain. We have not taught people how to manage their pain with meditation, with biofeedback, with so many things that are helpful, with hypnosis, with acupuncture, the things with homeopathy, that things that help us manage pain without causing the damage.
Yeah, I agree with you. Pain's a pointer, really. It's just pointing is telling us something is wrong and needs to be fixed. Would you agree with that? That's my take on it. I mean, whether it's to do with your
Absolutely.
spiritual pain or whether it's to do with your physical pain,
It's a
something needs to be
messenger.
fixed.
It's a
I agree.
messenger, and you
Yeah,
don't shoot the messenger.
good point. Good point. Do you have any other questions there, Victor?
Yeah, there are a number of questions. One person was asking about the use of probiotics in the form of an ultra-high dilution, that is, as homeopathic remedies. They were wondering if you have any experience using those.
I do not, but it's a great question, and we need research in that area. Someone also I saw flash across the board, what about the use of calendula in wounds? I don't know. We need more research in that area. Does it speed up wound healing, in fact, or does it slow it down? We don't know.
Mm-hmm. Yeah, and for the person who asked the question about probiotics used as homeopathic remedies, Luke Klein in his book Miasms and Nosodes, the second volume, has a short chapter on the use of some of those remedies if you're interested in reading more.
Excellent. I wasn't aware of that.
There are a number of questions about what can be done if a person has taken one or more of these types of drugs that you've discussed, and they've suffered as a consequence of their use. What's the general strategy for dealing with this problem?
Well, the answer to that is, when do you not run into somebody who hasn't taken, who hasn't taken one of these drugs and suffered something from it? So, it's extremely common. And I rely on classical homeopathic prescribing. I take a good history. I look for the simillimum. These are the things that actually have an impact. And that's why I said earlier, I'm not advocating that we don't use homeopathy. I'm advocating for homeopathy because it is so much in line with the microbiome. It is so much in line with the ecology of the body that we have the most powerful system of medicine in the world. We just don't even know it yet. And the evidence from the microbiome as it comes in is reinforcing what we do homeopathically. So there are different, there's isopathic techniques that can be helpful. There are homeopathic techniques. There are, what are they called? There's so many different ways of using homeopathy that have been found to be effective and crossing these hurdles that have been set for us with conventional medicine. You can't even begin, and people are figuring it out as we speak. And I would just say we haven't scratched the surface yet of what homeopathy can do.
Yeah, I've taken quite an interest in autopathy, which is
Yeah,
actually taking the,
autopathy is another
yeah,
one.
yeah,
Brilliant. Yeah,
very interesting,
yeah. And
and maybe
homeoprophylaxis. It's another thing.
another one that's really incredible. And yeah, we've got so much to learn, and I think that homeopathy though as a paradigm is probably the best paradigm for I would say leaning towards cure because
It's
and I
certainly
think
the
this
most scientific.
it does seem to be observation is something which is disappearing out of medicine these days.
Gone.
Yeah, people are relying upon sending off for your CT scan, all into the old way of doing it. It's I hate to think what's going to become of the next generation of medical doctors.
Well,
It's
it won't be. It'll be AI.
Yeah, I think there'll be two streams actually. I think one will be AI for sure, which is thought to be more empathetic and smarter than the regular doctor. And but I think there'll be another stream of doctors or healthcare practitioners that will split off on that. They'll be the ones that pursue the human quality of the healing interaction, and which is just seems to be disappearing now from the majority
Yeah.
of physicians' offices.
Yeah.
Do you have some more questions? I see that a lot of people in the chat and in the question are asking about specific conditions, such as shingles and nerve pain and things like that. And I think it would be maybe appropriate to say that you kind of can't give individual advice in a situation like this over a broadcast, and that if people can't treat it themselves with the first, a home kit that they have, if it's something like maybe a burn or whatever, that they need to really see a professional homeopath. Would you agree with that, Ron, or how would you advise
Oh
people
yeah.
who are
Oh
looking?
yeah. Well, first of all, homeopathy is so user friendly. These home kits, which have been in use in the United States for 200 years, um, and it's so forgiving that if you get the wrong remedy, as long as you are following general principles of homeopathy, you are extremely unlikely to cause any harm. Extremely unlikely. But yes, if you cannot come to a reasonable solution to what you're dealing with using your own home prescribing skills, definitely speak to someone who does it day in and day out for their bread and butter because they have experience in knowing what works more than something else. Try not to, even I've heard this argument go both ways, but I would prefer someone use a homeopathic medicine sparingly than have them use Tylenol or Advil for something like shingles, and certainly not an antiviral medicine for something like shingles, because I've seen shingles become post-herpetic neuralgia as a result of that treatment, whereas I've never seen it happen with homeopathic treatment.
More questions, Victor? Thanks. That was a good answer, Ron.
Yeah, well, perhaps one thing that would be useful to speak about is the reality that a lot of these drugs do actually have effects that extend beyond just the individual human being who takes them, because of course, eventually they make their way into larger ecosystems. And when they do that, they have a number of very adverse reactions, some of which we're just discovering. So I'm wondering if you could speak a little bit to that, because it's a topic that I think is increasingly important, but which gets actually very little attention.
Yeah, I am totally in agreement with what you just said, Victor. That we have been seeing the pollution of our waterways, our groundwater, our drinking water by pharmaceuticals now for 30 to 40 years. I mean, I've seen articles from the 1970s and 80s documenting that just about every freshwater source in the world is now contaminated with pharmaceutical agents. This is affecting the wildlife in these environments. This is really a critical problem. This is why I say it's another reason why conventional medicine is simply not sustainable. You can't keep doing this. It's going to build up to such a level that that we won't be able to avoid these effects without, even involuntarily, you are taking these medicines. Now, a corollary to what you said, Victor, is the American Institute of Homeopathy 2 years ago had a conference on cutting edge homeopathic research at the University of Connecticut in Farmington, Connecticut, where we had researchers from around the world presenting their work and their latest studies. And there were some who were studying the effects of using homeopathic medicine in groundwater and in lakes and rivers to treat the ecology in the entire estuary, and finding through measurable spectrophotographic effects that these medicines had almost instantaneous activity throughout the ecosystem. So we're talking about something that is sustainable and something that is not sustainable, something that's going to make everyone on this planet eventually very sick, and we're very close to that already, or something that can actually have a dramatic effect on helping people recover and keeping them out of these perilous injuries. But we have a lot of work to do to educate and to change the thinking that people have and to end the fear mongering that's unnecessarily taking place around so many topics that
Particularly
people are
childhood illnesses.
absolutely terrified to leave their trusted vaccine or their trusted antihypertensive medicine, even in the light of you can now show them that it's giving them dementia. You can now show them that it's making their memory go away. You can now show them that it's giving them chronic inflammatory illness. They're still terrified to leave. It's
Yeah, and
hearts and
the ironic,
minds. It's,
yeah.
you have to convince the heart and the mind.
Yeah, and the ironic thing is that in a sense, the overuse and abuse of these drugs becomes a self-fulfilling prophecy with respect to the fear, because the more
Yes,
you give into the fear, the more that reality that you're afraid of actually
yes,
comes into being.
yes, yes. We saw it with COVID.
Yeah.
We saw it with COVID, and people were dying in hospitals. Well, why do you think they were dying in hospitals?
Yes, I think the interconnectedness of things is kind of what we're ending up with here, that we're interconnected to all these organisms, and they're interconnected with us, and we're interconnected to our genetic codes and other people, the waterways, everything. I mean, there's nothing
Everything.
that can be plucked out and say it stands alone. And I wonder if the microbiome can affect people's genetics. I know you mentioned about the idea of passing down generation to generation, but I could see that passing down in an energetic form, which wouldn't require your genetics to be involved. Has there been any evidence of genetic changes?
Huge, huge amounts. Because first of all, if you look at the human genome, it's about, I'm forgetting the number now. It's in one of my presentations, but the majority of genes in the human genome comes from viral infections. Most of our genes, they didn't suddenly become human genes. They came from infections millions, hundreds of millions, billions of years ago, including the gene for consciousness called the ARC gene. The thing that helps us build memories came from a viral infection. And we've proven that through molecular biology. That's been shown to be the case. So yeah, genetics are definitely tied into the microbiome. The sole purpose of viruses on the planet is to spread genetic information from one organism to another. And if you spread it to the sex cells, I'm forgetting the technical name, you put it in the ova or the sperm, you're now on to the next generation. So yes, there's a lot of this that's been happening throughout. That's how we have evolution. Evolution was driven by the microbiome.
Very interesting. Yeah, and this whole idea of contagion too is another question that's coming up. In
Yep.
other words, it's very hard to transfer material from a coughing child onto an adult or another child, the material. And we start to wonder about this whole idea of microbiomes and information transfer and biofields. And it becomes more and more it's complex, and yet at the
Yes.
same time has a simple baseline, which is the interdependence of everything,
Yeah.
right?
Yeah. Yeah. Well, the things we used to consider humans are
Yeah.
these distinct organisms with boundaries. Well, no. When you go down to that level, first of all, you find that there's nothing but space
Yeah.
where we thought we were solid. But then you look at the biological component and you meld with the environment. You are not in this distinct borderline between what is you and what is the environment.
So
You are
true.
constantly interacting with it.
Yeah. So when you try to look for your own self, it's very hard. Now we have all we're sort of got all these organisms in us all over the place, even in our brain. So when you try to separate the self from the organisms and all this other stuff, it's very hard to do if you can in fact do it. Um,
Yeah.
I am disappointed to know though that you can't drink urine without drinking a lot of bacteria. So
So
that
what? Wait, wait,
disappoints.
wait, wait. So what?
No, I'm just
So
kidding.
what's
I was just saying
bacteria?
that as a doctor, we always thought that the urine was sterile.
It's not.
I know it sounds like it. So I'm going to have to stop drinking it now. And
No, no, no. It's a great Ayurvedic cure.
no, I'm aware of that. Yeah, particularly if it comes from a cow. But there are some things which really cause a doctor's mind, sort of fixed in dogma since medical school to change. It's
Yeah,
a real challenge,
it
you have to
is.
see the world completely differently. And I
Yeah,
always think that learning homeopathy is a bit like a doctor having to turn himself upside down, you know?
yeah. Well, I think what you're saying is true, uh, Stephen. And one of the reasons we know that is because it's very common that a physician who becomes a homeopath, I don't know about your case, but most physicians who become homeopaths, they become homeopaths not because they were convinced rationally that
No.
homeopathy works, but everything else failed them, and or a family member, and they were forced to open up their eyes to something like homeopathy. So it was
Yes,
direct experience.
that's true. That's true. For myself, it wasn't quite like that. I think when I saw cases of people being cured, that I'd had cases like that, patients like that over the years, and I started seeing them actually being treated successfully. Then it was for me, it was sort of a realization that there was still something miraculous in medicine that could be achieved. And
Good.
that made me start to pursue it. And, you start small and then you just get bigger. If you're
Yeah.
lucky, you have some experiences along the way, such as cured cases, that you
Yeah.
do, even though you're a complete novice,
I know.
that make you so enthusiastic that you just keep going.
Yeah. You go, how did this happen?
Yeah,
It is miraculous.
it is. The miraculous of medicine. That's homeopathy.
Yeah.
Were there more questions, Victor?
I think we've addressed the bulk of them.
Okay.
Yeah.
Well, I wonder then, Ron, if you could tell us if people want to hear more about your thoughts on these topics, where can they access this material? Like your
There's
website or something like that.
the website is homeopathicmd.com. I will be speaking at the next AIH conference in October in Farmington, Connecticut. I will be talking, I think, on the microbiome and something else. I forget what, might be pain again. And there's a paper that's actually listed on PubMed in the National Library of Medicine. If you type in homeopathy and the microbiome, that'll lead you to my paper.
I think I have that one. That's a really good paper.
Thank you.
Is that it
Thank
there?
you.
Can you
Yeah,
see
that's it.
Yeah,
That's it.
excellent paper. Yeah, really good review. And I also liked the article you wrote, which is what has changed in the medical field since COVID. I thought it was a pretty hard-hitting article there. I can see why you might not have been able to print that one or put it up
Yeah, yeah,
on but a few years ago.
yeah. No, it's still semi-hostile environment out there.
Yeah, but it's very good. I think the insights into the medical profession are really are really accurate and
Yeah.
eye-opening.
Yeah. No, because of COVID, I lost my appointment as a faculty member at New York Medical College. That because of the views that I expressed, they decided they just were not going to, how coincidentally, they decided not to renew my appointment, which I'd had for like 15 years. Suddenly, it wasn't renewed.
I think that's a fairly common experience among doctors that speak out and tell the truth.
Yeah.
And yeah, but it's also the beginning of the change.
Let's hope so.
Yeah, it's the only way. And so, um, did you want to just maybe, I would say first, maybe Dr. Whitmont, would you like to maybe have make a closing statement for the people who are listening still and leave us with a message?
Yeah, yeah, I think that the message is pretty simple. That what we that what's happening in the field of conventional medicine now is that the microbiome, which through the Human Microbiome Project, which started in 2008, has gone out in all directions and has uncovered so much material. And it's more material than any one person can actually consume. It's really everywhere. But everywhere you look, if you look carefully at what the studies are showing, they are inevitably supporting a homeopathic approach, and they are showing the damages from a conventional medical approach. So much so that when you start to connect the dots and you put the individual studies together, you can see that we're in an unsustainable position using conventional medicine, and that we need something fast that's going to replace it. Now, luckily, we have 200 years of experience using homeopathy in alignment with what we've been calling the vital force, which I believe is none other than the microbiome. No one can prove that, I believe. We don't know, but everything is compatible between what we describe as the vital force and the microbiome. If they're not the same thing, they're pretty darn parallel. And that homeopathy is still proving to be one of the most effective forms of medicine and one of the most scientific approaches. Hahnemann arrived at homeopathy through studying the natural expression of something in the body. Conventional medicine is arriving at this through the study of something natural in the body. They're using the tools of, molecular biology and, ultra filtration and computer generated information from the microbiome, gene sequencing technology. Why is it they're both coming to the same conclusion? Okay, and that I think is the important thing. And in order to grasp the conclusion, you have to change your paradigm and look at it from the angle that things like inflammation are good for the body in the short term, and they prevent long-term problems, and that the immune system is something that is helping us, and we shouldn't be beating it up with therapies and treatments that suppress it and damage it. That if we want long-term health, we've got to treat the body and support the sustainable parts of the body, and that means starting with the microbiome and treating these acute illnesses and acute injuries and acute inflammatory conditions in a responsible manner that respects what they're doing and augments their task and makes it more effective. And that's what homeopathy has always done. But we just didn't know it. We didn't really know why it was so powerful. And this is telling us why.
Thank you very much. I'll pass it over to you,
Well,
Victor.
wonderful. Thanks so much, everybody, for being here tonight. Thank you, Dr. Whitmont, for your wonderful presentation. And again, if you would like to stay up to date with what we are doing at the Canadian Coalition for Homeopathy, please visit our website, sign up for our newsletter, and we hope to see you at our next webinar.
Thank you.
Thank
Thanks,
you,
thanks,
everybody.
Dr. Whitmont.
You're welcome. Good night.
Good
Thank
night,
you all.
everyone.
Everyone.